Hello, my love. So nice to meet you here.
So great to see you too.
Yeah, it's been an eternity,
Yes.
hours at least.
So today we wanted to talk a little bit about our new technique called the Inner Freedom Technique, and also to talk about some of the clinical applications of this technique. And we together thought that you are actually the ideal client to discuss.
No, that's not true. We together did not think that. You pointed out. We were having a conversation about helping people understand, where the rubber meets the road with this kind of work with, the people in their clinic. There's to everybody listening that has expressed interest in the work. That's wonderful. But then there's also questions about, okay, well, what does it do exactly, and how does it unfold in the process of working with a client? And we were trying to figure out how best to convey that. And you pointed out that my experience is actually a pretty good model for that. And
Yeah.
I think you're right.
Yes. So a lot of people come into our clinic with chronic pain or with old injuries that haven't really completely healed, and they've seen many different kinds of practitioners. And at some point along their process, usually someone will say, perhaps this is psychosomatic, or perhaps there's an emotional component to this. And the person may or may not have transitioned into some kind of emotional work, including talk therapy or EMDR or
Hmm.
etc. So a lot of times people do come in that situation, and that's the exact situation that you found yourself in back in 2015-ish, right?
Well, um, that was certainly the situation. I don't know that I recognized it as such
Okay.
necessarily at the time, and I think this is often what, again, especially with those of you who are listening with existing practices, especially the body workers. I think the applicability will end up being more akin to people who are having pain, difficulties, symptoms that maybe you're getting some traction with, but it kind of ebbs and flows, and nothing's really permanently changing, and you're kind of scratching your head, going, "Well, what else is going on here?" Right? That I think was the situation that I was in. So again, for those who know me, which I think is probably three-fourths of the people who are listening to this, and especially those from the bodywork communities, my history of having really bad, painful, difficult low back for most of my life. Uh, those of you who were in NKT or PDTR with us, or around the same time frame, that was always the center of whatever work was being done for me, right? And
Yeah.
there was always that thing in my head, right? Like when I went to train in NKT, like, oh, that maybe somebody will figure me out, right? And then, oh, that maybe kind of not really. And then PDTR, this is it, right? Yes, I'm learning it and using it with people, and it's wonderful, but I'm also sort of going through that experience thinking maybe the next thing we learn is the thing for
Yeah.
me, right? That
Yes.
will, help this transition, and help me get out of pain. And so, I spent a lot of time and energy and people in the class working on me for practice. For those, again, who know PDTR, I did a bunch of sessions with Dr. Palomar when we would travel up there, letting him work on me. And
What was your symptoms like? What was your daily like quality of life like?
yeah, so the history with my back is, the first injury that I had to it, I was about 13, 14 years old. It's a debilitating injury. I couldn't really do much or move for, weeks, if not really a couple months it took to heal. Um, and then I had another one that was bad enough that I was afraid for a period of time that I wouldn't be able to play my senior football season, which would have, you know, destroyed me at the time. Um, and then I injured it again, several other times. Once as a freshman in college, really, really bad, doing heavy power cleans in the gym, literally to the point where I couldn't walk. I literally couldn't stand up off the floor and move. So several really bad acute injuries, and then just a lifetime of pain and dysfunction. I think back, and I don't know how I managed to play 4 years of Division I football and 4 years of professional football until I was in my late 20s. I don't know how I did it, because for much of that time when I wasn't actively working out or on the practice field or playing a game, I was non-functional. Like I couldn't lean over a sink to wash my hands or brush my teeth. I was physically incapable. I would have to
Yeah.
like do a sumo stance, like widen my feet out to lower my hips down so that I could kind of lean in a little bit or support myself. Literally physically had to hold myself up with one hand.
Mhm.
Um, it got really, really bad after I retired. So this would have been, I was 28, 29 years old, where I know that it makes no sense, but I swear I was in pain 24 hours a day, including when I was asleep.
Mhm.
It's like the sensory awareness of pain never really subsided. And it was a massively destructive to my quality of life. I wasn't sleeping. I was always in a bad mood. I had no energy.
Mhm.
So I was in significant constant pain. I think about sort of the psychological ways that it would show up, where, if I was carrying something, if I'd like dropped a pen, that was enough to like ruin my day, because I'm staring at this pen like, how am I gonna this is going to take a monumental effort and be really painful just for me
Yeah.
to bend over and pick this up. So there were some things that helped. The first big one was prolotherapy. I had,
Mhm.
a couple of huge, really aggressive prolotherapy treatments that brought me out of the worst of that, gave me, I would say, maybe a couple years of relief, not resolution,
Mhm.
but relief. And then it started showing back up again.
Mhm.
When it was there when you and I met, again,
Mhm.
if people were around for either the NKT or PDTR, I would sit through those courses over the weekends, and I was sitting next to you. You were aware of how physically uncomfortable I was,
Yeah.
constantly throughout the whole thing. Again, having Dr. Palomar do some work, other people working, and some things would bring relief, and it was nice when that would happen, but it was always just kind of all over the place, and there wasn't a clear trajectory of improvement, and certainly there was never any long-term, lasting, permanent resolution from
Right.
any of the physical interventions.
Right. Okay. So when you so tell me or talk me through how what you decided to try instead.
Okay, so this is the interesting part, is that um, it wasn't really about my back when I got into, again, this form of work, this form being hypnosis, the inner
Mhm.
freedom technique. Obviously, it wasn't our version of this work, and it wasn't called inner freedom technique at the time, but same
Yes.
same work essentially,
Yes.
right? Um, I really dove into it deeply because my life was in turmoil. I was miserable. I was going through well, my marriage was really bad. I wasn't quite going through a divorce yet, but then eventually going through a divorce.
Mhm.
And there was just a lot going on that just led me to sort of internally go, all right, I'm over it. Like I'm really ready to change these lifelong patterns. Um, but I wasn't really thinking about my back with that in mind, right? So I started doing this form of hypnosis work.
Mhm.
Um, and well, you remember as well as I do, because you helped, you were
Yes.
facilitating much of it for me. And then you have
Yes.
that mind of yours that keeps track of all of this. But we did clear physical traumas
Mhm.
related to my back and any other injury I had. Not necessarily oriented towards resolving my back. That wasn't the goal that I had in mind at the time. The goal was I want to feel better emotionally, psychologically, etc. Right.
Mhm.
Um, but just as a part of the practice, and as people will learn, that's almost always the default starting point, because
Yes.
it's such low hanging fruit, that you don't have to have drawn a straight line between this trauma and this experience and understand how they're connected. You just know if you've experienced trauma, it is affecting you, right?
Mhm.
So we did a lot of trauma clearing, and then I was doing a lot of resolution, a lot of hypnosis work around life themes and relationship themes. So things coming up in my marriage, things about feeling unwanted, not good enough. These didn't just exist in my marriage; these were lifelong themes, right?
Yes.
Those are the things I was wanting to change, is these lifelong themes. So we did a lot of work around that. And then we did do, at some point, I don't remember when or why, we decided to do some back focused work.
Yes.
And we did what in this work we call a complete clearing around all causes for having back pain. What else did we do?
I think you've said it all.
Okay.
You were focused mainly on um, resolving the experiences of having the back pain, all of the different physical injuries, and all of the feelings about your spine, about your
Yeah.
back, and about yourself as an athlete.
Yep.
Those are all important parts of the work. And then at some point, you decided that you wanted to do a deep clearing
Mhm.
on the causes for having back pain.
Yes. And at the time, actually, now that I'm recalling, that had as much to do with recognizing the sort of symbolic quality of the back pain
Mm-hmm.
and realizing that whatever was causing that was also going to be deeply connected to a lot of these other non-physical experiences I was having that I was wanting to shift as well. Right.
Right, right.
So, okay, all that being said, the point of this is that years and years of physical intervention, some things would help, some things did nothing, ups and downs, periods of time of relief, but again, no long-term resolution. At some point in this process, and in my mind, it was always about 9 months.
Mm-hmm.
I've had that number in my head. I don't know how accurate that is, but it's close enough. 9 months from the time that I made this conscious decision to dive into this work and just systematically go about using this approach to resolve all this stuff that I didn't want to deal with in my life anymore. It was
Mm-hmm.
about 9 months into that one day I got up and I started walking around in the morning and I went, wait a minute. How long have I just been getting up out of bed? Because that's not a thing that I do.
Yeah.
Right. I mean, for literally a decade, if not longer, I would open my eyes and the first thing I would register is pain.
Mm-hmm.
And I could not physically sit up out of bed. I would wake up, I would go, ouch. And then I would, have to carefully roll onto my side, kind of drop my legs off, walk myself up sideways. Right. Um, that was just how I did it. That was just life for me
Mm-hmm.
forever.
Mm-hmm.
And then especially in the morning, being in a lot of pain and not being able to physically lean over to, splash my face or brush my teeth or whatever. And so again, at some point in 2016, I think it was, after 9 months or so of this, I just realized I was just getting up out of bed and moving.
Mm-hmm.
And I hadn't had any physical interventions during that time.
Yeah,
Uh,
nothing of significance.
no, I
Yeah.
mean, a massage here
No
and there.
prolotherapy,
No,
no.
no,
Yeah.
you would kind of, poke around and do some body work, but
Yeah.
nothing I hadn't been doing for years.
Already.
Right.
Yeah.
And yeah. And I just suddenly, it was just gone. It just wasn't there.
Mm-hmm.
And, that's been true since that time. I've had a few things happen with my low back since then, but it's not the old patterns and the old pain. It's been, frankly, me being stupid and acting like I'm younger than I am, and trying to pick 400 pounds up off the floor when I haven't consistently trained for that, and deadlifting,
Yeah.
or heavy squatting, or whatever it is. Right. I had a few like acute things. I went, whoops, okay, backed off, they healed. But after, from the time I was really 13 or 14 until, I mean, a good 20 years, I was a bad back guy. And
Mm-hmm.
all of a sudden I wasn't.
Yeah.
I'm just not anymore. I'm just not in pain. I mean, I can't emphasize that enough. It's not like, oh, I have good days and bad days, but more good days now, or it's 90% better. No, I do not have any of the pain that I lived with daily for 10 to 20 years.
What are some of the things that you can do now that you would never, besides like washing your face and
Well,
getting out of
I
bed?
want to emphasize that I don't think of it as besides those things. Like those are the big thing. Like
Yes, those are important.
when you can't do those things, right? Those are the things I'm most appreciative of. Um, you know, I can do anything I want to do now.
Yeah. You
Like
train really hard.
I do. I train hard. I mean, I still have to be cautious in the gym. Again, I've learned over the last couple of years as I do well and get stronger in the gym, maybe because of the old injuries, and I've got, you know, a rectus abdominis, you know, a diastasis that I think that I'm going to have repaired that probably affects my core stability. I've just learned like, okay, my deadlifting limit is like, you know, 365. Like, and I need to be careful with that.
Yeah.
So I'm limited, but that's not different than any other 45-year-old man. Like, you know, I
Yeah.
have to not be stupid, but
Yeah.
that's not a reflection of this old, you know, these old back injuries and trauma and the symptoms that I used to live with. None of that's there anymore. There is effectively no limitation
Yeah.
in that sense. Yeah.
And so I wanted to mention, because I remember these things. I remember, so in the work, when you're doing a deep clearing on something or deep resolution of a theme, the first thing that we ask a person is to go back in time to the first experience that has caused the theme. So if the theme is back pain, I was the one facilitating this session with you, and I asked you to go back in time to the first experience that caused you to have this back pain. Now, logically, you would think that would be this injury that you had at 13 years old.
Mm-hmm.
However, that's not what you said.
Right.
You said it was in utero.
Mm-hmm.
And of course, a person cannot, most people cannot remember what happened to them in utero. And who knows what that was? That could have been a physical trauma to you as a fetus. That
Sure.
could have been something emotional and stressful that your mother was going through, or someone even around her.
Mm-hmm.
Because when we're inside the womb, we are very much in the unconscious, right?
Yes. Mm-hmm.
We're very open to influences of all kinds.
Mm-hmm.
That's why there's so much folklore around protecting a woman in her pregnancy
Yeah.
from negative experiences.
Mm-hmm.
Protect the child.
Right.
At any rate, so it all went back to this experience in utero. And then as part of resolving that experience, we asked about beliefs about your body and your health, beliefs about yourself, beliefs about being safe or feeling safe, beliefs about trusting yourself and your body.
Mm-hmm.
And there were all of those present, which is fascinating to me.
Right. Right. That's the beginning of our conditioning is happening in utero. And to be clear for people who are listening, because you said, I said, my subconscious said, right? I
So
have
you
no,
indicated with
yeah,
your indicator.
right.
Yeah.
I have no conscious recollection of that experience,
Mm-hmm.
what it was. It's precognitive. So
Right.
the subconscious is able to identify it and resolve it. I was aware of what it had found, you know, in terms of time frame, but I in the subconscious identifying that, people don't necessarily recall the experience, even if it's 7, 8, 9 years old. The subconscious may just find it and say, yep, I've got it. That
Mm-hmm.
doesn't necessarily correlate with a conscious recollection. It doesn't have to.
Right. Yes.
Yeah.
And so when you're doing a deep clearing like that, you're releasing and resolving this original experience and all other experiences that have caused the back pain,
Mm-hmm.
some of which may have been physical traumas, some of which may have been emotional traumas.
Mm-hmm. Mm-hmm.
I don't know, because there's could be hundreds of things,
Yeah, that's
all
right.
contributing to the same theme,
Yep.
which is why hypnosis is so powerful for resolving physical conditions like this, because there's so much subconscious input.
And yes, and because in the non-dual body mind sense, there is no difference between physical and emotional,
Mhm.
right? That's an artificial split that our ego function creates, right? So when we're looking for root causes of physical symptoms, and in our old way of working and in the way that many of you are listening are still working exclusively, it's a wonderful way of work. We've helped many, many people over many, many years. But if you're only looking to resolve physical symptoms through physical causation or physical means, then you're potentially missing a lot, because
Yes.
there is no rule in the psyche that says that the cause of a physical symptom has to be a physical trauma.
Right.
Right.
The other benefit of using hypnosis to resolve a physical symptom like this is that there are experiences that have caused the problem, but then there are also other causes, other miscellaneous causes
Mhm.
that are very hard to work with the body, even if you are a somatic practitioner, even if you're someone who is experienced in something like emotions code or body code or somatic experiencing.
Mhm.
There's just so much potential. For instance, one of the other items in the deep clearing script that I asked was, is there someone you've identified with? And this thinking that you're like this person has contributed to beliefs about your body that have caused this pain.
Mhm.
And how you're going to get that with,
Yeah.
I mean, I don't know how you would.
Right.
That's
Right.
something that a person in the process of this script unfolding, the person can come to consciousness about this.
Mhm.
When you ask a person that question in trance, they're not out of it. They're actually in a deeper state of focus and thoughtfulness. And so, for instance, it may have never occurred to you that your dad also has back problems.
Mhm.
And there may have been identification with your father, which is a natural part of being a male child of
Mhm.
just identify with your father, and female children also identify with the father.
Mhm.
And if you've ever thought, I'm just like my dad, even subconsciously, you're taking on mentally and
Mhm.
symbolically whatever your dad is holding,
Mhm.
including his back pain, his mental attitudes, whatever. So those are the kinds of questions that a hypnosis script can bring up into consciousness and get resolved, that no other work that I'm aware of can do as effectively or as efficiently.
Yep.
And there's other work that can do it, but it's more conscious.
Right.
And the downside of working with something when you're totally awake is that if you don't want to look at something, if something's very painful to address consciously, your subconscious mind will suppress it. And
Yeah.
you'll just
There's more
won't
resistance.
know.
Yeah. Yeah.
Right.
Mhm.
So that's how we would take a person with a physical issue, a symptom of some kind, and work with them through the process. We would first address the trauma or the negative experiences, difficult experiences. We would maybe do some other similar themes to that, and we would eventually at some point get to do a deep clearing or a deep theme,
Right.
clear all the causes for something.
Yeah. And so, just to spell it out a little more directly, for those of you watching and listening, contemplating taking this training, how this would work in practice is, you're doing your typical work with clients, and um, you reach a wall with somebody, right? There's some level of improvement, or maybe, it's one of those cases that's really difficult, and there is no improvement. Um, and combined with, maybe, again, some of you have techniques where you can tap into and recognize that there's emotional stuff or trauma
Mhm.
happening, or you're just intuitive and you get that. Well, now, instead of saying, well, that's it, we've this is what I do and I've done what I can and you're not getting better and I'm sorry. Now
Yeah.
you don't have to refer that person out. Now there's this entirely new dimension of work that you can, and this is, I've made my career the last 6 or 7 years having this conversation with people,
Right.
because here's the secret: it's everybody.
Yeah.
It's absolutely everybody. And so, you get to wherever that natural stopping point is with people, either because you can't go any further and they're not getting better, or sometimes they have gotten better, but in the process of getting better, you've developed a strong relationship, they trust you, they like working with you, and maybe there's even been some conversations about how trauma is related. Well, either of those cases, now you have this entirely new dimension of work available that you can sort of graduate these clients into.
Yes.
And again, that's how I've done it in the clinic for years. I end up having this conversation with everybody at some point, about how their trauma, their history is wired into the nervous system. Sometimes we're finding it on the table through the PDTR, emotional intervention technique. And I have the conversation about, well, there's the other form of work that we do that really helps to make sure that all of this is completely resolved, either A, because you're not getting better and the weight of all of this subconscious stuff could be why, or you are feeling better, but let's make sure that we've resolved all of the subconscious trauma, patterning, etc., that led to this in the first place, so that it doesn't happen again.
Yeah, absolutely. Because what sometimes happens when you have a symptom in the body, if you don't, this has been my experience in myself. If you don't resolve the underlying causes for the symptom, you get a flare up or a recurrence of the symptom every time that thing is triggered.
Yep.
So I did some similar work for myself around a symptom that I was having in my body. So back in 2017, I was going through a breakdown of a friendship and a lot of tumultuous. I mean, we were opening our first clinic together in a building, brand new, lots of financial stress, lots of interpersonal stress, just balancing a lot of things. And I got this terrible arm pain, and it lasted for a year. It lasted for a very long time. And I did all the things. I mean, I saw the chiropractor, I saw Tori, our chiropractor colleague. I did Pilates to try to strengthen my neck and shoulder. I had massage work. I had PDTR. I did emotional clearing. I did a PDTR related emotional clearing. I did clearing, like actual hypnosis work. And it wasn't until I had enough consciousness to recognize the patterns that I was living in relationship were harmful to me, and I was continuing to have these kinds of relationships, that I was able to my body literally just stopped having pain overnight. And I got to that level of consciousness through the hypnosis. It was through the slow breaking down of all of these attitudes of what it was like, how I was supposed to be as a woman, as a mother, and as a friend, as a therapist. I had to get through a bunch of layers, and then literally spontaneously the next day I woke up and I had no pain. I mean, you would call it a miracle, except I worked my ass off
Right.
to have that result.
Well, it can be both.
Yeah.
Yeah.
And I really do credit the hypnosis process, because I needed this to be brought into that awareness slowly. I needed to slowly recognize that I was in relationships that were bleeding me dry.
Right. Yes. And so, this is an opportunity, this work, to really have something to use with people long term for huge shifts in their life, physically, emotionally, spiritually, and otherwise. Right. And also, we've both had plenty of experiences with our own bodies and minds, and with clients of sometimes people just need a single session, and
Yes.
something incredible happens. There's a dramatic shift, pain goes away. I mean, you've used this with clients and who have things like Hashimoto's, and suddenly the Hashimoto's is gone.
Yeah.
Right.
They don't have any active symptoms.
Right.
Yeah.
And that happened in like 2 or 3 sessions, if I'm not mistaken.
Yeah.
Right.
Number of autoimmune conditions is one of those. When you resolve the underlying trauma, the body relaxes, there's less stress held in the body, and then the body can resume its normal functioning.
Right.
In a lot of cases,
And
even
so,
when it seems illogical.
right. Yeah. And so, again, that has the potential for long-term usage with clients, but it's not necessarily, not every case is a long-term case or doesn't need to be. There's ways,
Absolutely.
scripts that we will teach and ways of using this work to be very sort of precise and acute with the intervention. That's often all that people need is just that one stuck piece to be addressed, and it allows a whole bunch of things to shift. So
Yeah, I would say on average, 75% of my clients come in and see me for anywhere between 1 and 5 sessions total.
Hmm.
In their entirety of the work that they do with me. I mean, I've got bins and bins of people that I've seen 1 to 5 times.
mhm.
And 25% of people begin to do this kind of hypnosis, this work, and they become fascinated with getting to know themselves. And they want to do more and more because they see themselves evolving over time. As each layer is peeled back, there's a new version of themselves that shows up,
Mm.
and they can see new things. They can see new patterns that they couldn't see before. And once they see the new pattern, they're like, okay, I'd like to peel that away. Thank you very much.
Mhm.
And on it goes. So there's some people that I have literally seen since I started doing this work back in 2015. So for 8 years. And there are some people who, like we said, just come in, they come in and they come in and they go. They get what they need and they are off.
Yep.
And then I might see them again in 2 years. And
I was going to say, and often that's happened where, in fact, somebody's on my schedule today, and I was like, this name is vaguely familiar, and I think I saw this person like 2 or 3 years ago for one session.
yeah,
And sometimes like that's enough. Like it's a big shift or it's a big whammy, but we don't know that. We just
yeah,
they just disappear, and then they'll come
yeah,
back literally 2, 3, sometimes 4 or 5 years later, telling a story about how impactful it was, how much has changed, and now they're
yeah.
ready for like the next
The next thing.
thing. Yeah.
Yep.
So okay. Well, hopefully for all of you listening, that gives you a little bit of a taste of what's possible with this work, the application of it, how we've used it in the clinic, how you can begin using it in the clinic, and what sort of things that you can use it with, and expectations for what can happen with it. And I'll send out more information. We're going to try to find a time to set up a live Zoom Q&A for anybody who's interested, so that we can talk to you, address any questions, concerns, things like that, in a live format. So keep that in mind, and be on the lookout for some information about that.
Yes.
Okay. Bye-bye.